Mention was made and agreed by the Executive last evening. On top of the existing restrictions on households across Northern Ireland, the Executive has now agreed necessary and significant additional measures which will have an impact on the rates of transmission, but will also impact right across society, all our lives, and indeed on many livelihoods. As you know, there are time lags between new cases and hospitalisation and sadly deaths. And these measures agreed by the Executive will not bring about overnight change. It will take a minimum of 2 to 3 weeks before we see the full effects. But the measures agreed by the Executive last night can help us get on top of this situation again. They can, as the Minister has indicated, achieve the reset that we need so badly. We can reset the level of community transmission, force it down by significantly reducing our contacts with others. And we can and now have the opportunity to reset all of our behaviours and our relationship with this virus, to shake off any remaining complacency, any doubts that any of you had about the threat posed by COVID-19. If you still think this threat is being exaggerated, it's time to wake up. It's time to look at the increases in cases, hospital admissions, and deaths. Think where we could be heading if we keep going on like this. This reset is a high price to pay, and the stakes could not be higher. How effective it is depends on all of us and all of our behaviours. The new measures agreed by the Executives will only work if each one of us recommits to strictly following the public health advice. And when I say they can only work, I mean they can save lives, stop our health service being overwhelmed, and help protect all of us, and protect non-COVID health services. And that's really how important all of this is. I know that this has been an extremely tough time for many in our community, not least of those businesses who will be severely impacted upon the measures that have been agreed. There are no easy answers, only difficult choices, with a series of harsh impacts. I acknowledge that the vast majority of you as citizens of Northern Ireland have been and continue to do the right thing, and I want to thank you. I acknowledge the large majority of our businesses have worked very hard to keep their premises, their customers and their staff safe. Thank you. And let me assure everyone, and particularly those in the hospitality sector, that there is no blame being attached to anyone for the situation that we're seeing at this point in time. We can only get through this if we all continue to work together to drive down the rates of transmission in the community. Given the case numbers we are now facing and the consequences for all of us and our health care system, we simply had to act drastically. We simply had to take very, very difficult decisions to curtail indoor social contacts. And we all know that extreme times call for extreme measures. I deeply regret that. I deeply regret the impact that it's going to have on many livelihoods, and I deeply regret the concerns that it will cause for many. A reset period will allow us to further embed the increases in testing and new testing technology, and to maximise the benefit of new digital innovations in our contact tracing service that complement the Stop COVID NI app. As many of you will know, an online self-service contact tracing system has now been introduced for the majority of people who test positive for COVID-19. They will get a personal code which they can use on a dedicated website to input details of people they've been in close contact with. And if we successfully push the number of cases back down, our health and care service can regroup, and its already exhausted staff can be supported and protected. And I just want to record again my sincere thanks to all of those health and care staff for all that you're doing, you continue to do, and what you're facing into in the weeks and months ahead. This reset will not be achieved by government action alone, and I know that that's a tired message that you've heard from here on many occasions. We all must play our part. It nevertheless is still true and still central to our response to COVID-19. We can all shape the weeks and months ahead. Our actions will determine whether, once again, we can get COVID-19 under control or it continues to advance with all of the consequences. Please don't look back with regret or with if-onlys, because people's lives do depend on this. And many right across Northern Ireland have already sacrificed and continue to risk and sacrifice so much. So follow all the official advice. Reduce your contacts, keep your distance, wash your hands, wear a face covering, download the Stop COVID-NI app, and if you have symptoms, self-isolate and get a test. Thank you very much indeed.
Health Minister, given the huge rise in cases, is it not a question of when our hospitals will be overwhelmed, not if?
Definitely not, Sharon. And I think that's why we're taking the interactions that we are now. Because if we do get on top of this virus the way we did before, we can stop those hospital admissions, we can stop those people entering ICU. There will be a trying and testing period for our health service over the next couple of weeks, but what we've proven is the resilience of our service, the resilience of our staff, and something that I thank them for when we've seen the dedication and the commitment that they put together in the first wave. Today I've announced that we're moving the Nightingale to a regional facility. That's a big step, because that allows us to concentrate the ICU provision for our COVID patients in one centralised location, when other trusts and other hospitals find that capacity challenging as well. So while we look at the services that we can provide and want to continue to provide, it builds on the work that we've already done in regards to orthopaedics and elective daycare surgeries, and starting at the regional approach so that we can maintain as much of that service as we can. But one thing I cannot do, and I don't think any health minister can do, is bring and create staff out of nowhere. You know, when we came back here in January, when this place came back, it was because we saw our health service workers and our nurses on picket lines. We made commitments then to increase their numbers. That takes time. We still have vacancies across our health service that if we had filled would put us in a better place. We haven't had time, or those people aren't there to recruit or fill those vacancies. But we will work and we will do all we can within the health service to make sure we support people when they need the support of the health service.
We have had 11 deaths in the space of just a few days. I mean, these restrictions won't stop the deaths with COVID and those critically ill. So what are we expecting over the next week or two once those huge rise in cases translates into hospital admissions?
Sharon, it's one thing I don't want to put predictions on is people losing their lives, because one of the differences that we have seen between the first wave and what we know now is the change of medical supports, the change of medications and the change in treatments, that we actually see a better survival rate for people getting into the ICU as well as those simply being admitted to hospital. But that's the medical challenge that we have. We would rather prevent people having to enter the hospital centres or end up in ICUs. Michael, do you want to pick up on?
Yes, thank you, Sharon. We are going to see further increases in admissions to hospital, admissions to intensive care, and sadly deaths over the next couple of weeks. Unfortunately, those individuals have already acquired their infection and will work their way into hospital, hopefully in smaller numbers. And as Minister indicated, with better treatments, I do trust the outcomes for those individuals will be better than before, and there's evidence that that will be the case. However, this is about now preventing the situation that you've mentioned about our health service becoming overwhelmed, us having to stop entirely all other services with all of the consequence that brings about. So this is really about us all playing our part to get R down below 1, as far below 1 as we possibly can, for as long as we possibly can, so we can get this epidemic back under control.
Hi, Louise.
Hi there. So it's a question really for all three of you, I suppose. Given the warnings that both schools and hospitality could have closed for 6 weeks and that's not happening, is there a trade-off then with the other restrictions around weddings and sport and so on? Is that enough to bring the numbers down if you're not going for the 6 weeks?
Louise, I think what we produced last night and what we've agreed unanimously as an executive was a collective approach of what is a 5-party executive, and I think it's been well received. Well, I don't think it's been well received, but it was a piece of work that shows that all of us within the executive, have a combined and united approach as to the ability to come to decisions that actually drive down COVID infections and save lives. The interactions that are in the paper and have been supported, we believe are for long enough and are hard enough in this instance to have a real impact on the spread and get R down to below 1. What we then need is the engagement of the people of Northern Ireland to maintain all those practices that we used in the first wave: good hand hygiene, good respiratory hygiene, social distancing, and now wearing face masks as well, so that we can keep R below 1 for as long as is possible.
Okay. Right. And just then to follow up, the Chief Medical Officer described this as acting drastically and deeply regretting that. Will you now make public the rationale for these decisions? How can you expect people to buy in if they don't know what is actually prompting them, what the evidence is?
Louise, unfortunately, what prompts these decisions is the rise in positive cases. What prompts these decisions is the rise of hospital admissions. And unfortunately, what prompts these decisions is the number of people losing their lives from COVID. So that's what united the executive in making the decisions that we had to take and the decisions that we took last night. Michael or Ian?
Yeah, maybe briefly, and I think, thank you, Louise, and Ian may wish to comment as well. I mean, I think what we know back from March is that the series of interventions that we introduced at that time, the executive agreed, had an impact of reducing R from somewhere in the region of 2.8 to 0.7, so a 75% reduction. Now, each of those measures is a single intervention, and it was the cumulative impact, so it was the sum of the individual impacts that actually made that very significant reduction. And what we've actually secured is executive agreement to a very wide range of measures, particularly in relation to social contacts outside of the home, social contacts that occur around the school environment, largely outside of school as opposed to in school, and a series of other interventions which cumulatively will have the impact, we think, from the modelling and believe from the modelling of reducing our below 1 and, as Ian has already indicated, over that 4-week period between 0.7 and 0.9. And obviously the longer and lower we can keep our below 1, the more of an impact that we can have. However, it's really important, really important that we say this, that the maximum impact is down to all of us. These measures will work and will have the impact that we desire if we all stick with them. We follow the rules, follow the guidance, follow the advice, and we need to make the most of this period. Ian, I don't know if you want to add to that.
Yeah, the key is an intervention which reduces the number of interactions between people, the contacts that we have. And anything which increases contacts will tend to increase R. Anything which reduces contacts will tend to decrease R. The package of interventions, we're reasonably confident will bring R down to less than 1, and the longer we can keep it there, the better. We will be monitoring it very closely throughout the period of restrictions to see exactly what impact the restrictions are having, and we'll continue to provide feedback on that throughout the period to Minister and to the Executive.
Okay. Good afternoon, all. Good afternoon, all. Rebecca Black from PA Media here. I wanted to ask, first of all, whether there's any disappointment that the Executive chose to reach compromise and didn't go the full hog with what had been recommended in terms of restrictions. And also, earlier this year, obviously, we had a period of restrictions and that flattened the curve and it brought the numbers down. However, as people came out of that, we started mixing again, the numbers have gone up. How can we avoid that happening again if this series of restrictions works and we get the numbers down again? When people start mixing again, will they go up again? And essentially, are we now stuck in this period of lockdown spike?
Rebecca, I don't think that lockdown spike as you referred to is feasible. I don't think it's long term. I don't think we could ask the people of Northern Ireland to commit to that sort of ever-rolling cycle. So that's why we have to emphasise that the measures that we're taking now are for long enough, are for hard enough to get R down below 1. But then it is, as you rightly say, about the reliance on people following the regulations that we put in place for that period of time. But by following all the things and doing all the things that we did back at the start of this year, which worked. Now, we did see that complacency, and we spoke often here about our concerns about complacency when people just got, I suppose, took that step when we saw low numbers of positive cases, 0 deaths, and very few hospital admissions, that this had gone away, and we'd been over this, or we were through the worst of the pandemic. We cautioned, we warned that we weren't, and we needed to re-engage. Where we are now in regards to this 4-week period, while we're through that, if we can re-energise the people of Northern Ireland to re-engage with that messaging and keep that behaviour going for as long as possible, it keeps the rate of infection as low as possible for as long as possible. And that's what helps us in the health service, and that's what prevents the further spread of COVID-19.
Thanks, Minister. On that point, you refer to complacency amongst the public. I think it's fair to say there's also a growing sort of frustration and anger among the public, and obviously that brings with it risks that people won't comply to the same extent they complied last time with the restrictions. With that, there's an increasing demand for the public to see the scientific evidence that the Executive sees in order to make its decisions. We've seen some slides today which show the very dramatic rise of the virus, but these sort of bits and pieces don't seem to be enough to satisfy. Last week, Professor Young was asked at the Health Committee if Malays could be shown the scientific advice that the Executive receives each meeting before they decided on restrictions, and he responded that that was a decision for the Executive to take. As part of a measure to try and deal with this sort of increasing cynicism about COVID, do you think it might be an idea to be able to publish some sort of digestible version of the scientific evidence or something to help bring people back on board?
Well, I think the fact that we stand here every week to give out the message and make it, I think, as you say, Rebecca, digestible, we answer the questions that are put forward to us. The publication of executive papers is up to the Executive. We've said that before, and we've asked how that process actually can be brought about. But the data that is available on our dashboard, the data that's available through Ian's presentations, the science that drives a lot of our decisions come from SAGE advice, SAGE guidance. Those minutes, those presentations are available on the website. Michael, I don't know if you want
just very briefly, and then Ian might wish to comment on that. Thanks, Rebecca. And I do recognise those calls, as you've indicated, and people absolutely want to be reassured that decisions which impact on their lives and livelihoods are actually based on the best available advice, and that can be provided to the executive. Just to reassure you that all of the minutes and papers which forms the advice that's provided to the executive through Ian and myself in the main are available on the SAGE website. Many other papers are published in peer-reviewed journals. The one thing that we've seen throughout this pandemic is the pace with which the scientific community has moved to actually get publications into the public domain, sharing it with international colleagues so we could all rapidly learn about this virus. And I agree with you, it's absolutely important that we are fully open and transparent with the public about decisions which impact on their daily lives. Ian?
I mean, we're always very happy to honestly answer scientific questions. I mean, I can talk about the science for hours, which is probably not what anybody really wants to hear. Whenever I appeared at the Health Committee, I mean, I highlighted the very large volume of evidence available via the SAGE website, and I highlighted the fact that we also look every week at a significant volume of published scientific papers, and we look at reports from bodies like Independent SAGE, and we look at international experience. So the volume of evidence is very high, most of it publicly available. As I say, we're always very happy to answer specific questions about the evidence when those are put to us.
Afternoon, Nigel Gould, Downtown Radio and Cool FM. Just to pick up something that Rebecca said there, if you don't mind, I think it's now very, very clear, if it hasn't been already, that this virus is pretty much here for the foreseeable future, and certainly a vaccine is not coming anytime soon. I spoke to Dr. Margaret Harris from the World Health Organization recently, and she said it was important now to find better ways of living with this virus. Do you think maybe now we need a radically different approach, you know, a complete rethink to look after all of us sort of longer term, if you like, rather than any kind of aggressive strategy involving lockdown in some shape or another? I think, Dr. McBride, you referred to a reset. It's clearly having a really significant impact on businesses and may not even tackle the surge adequately. It does feel again a wee bit like the can's being kicked down the road. What happens if this doesn't work?
I think, Michael, you summed up some of the challenges and the debates that were had within the executive last night as to the effect that we look at this as a collective, because the effect our decisions have on health, on the economy, on societal impact, and on our schools as well. One of the things, as I said to Rebecca, we don't want to get into that repeat surge on, off, on, off, on, off. So that's why we think this 4-week extended reset period actually drives R down below 1, because it is for long enough. It's also for hard enough in the measures that we're taking, but those hard measures will have impacts, and that's why I welcome the cross-executive action from my colleague in the Department of the Economy, who really has the understanding of what these actions have on our business society, on our hospitality society as well. So, she champions that. She argues for the support measures that are there, supported by our finance minister as well as the executive as a whole. So I know, the two of them are doing that piece of work to make sure there are support measures for those businesses. But the question in itself is what happens if this doesn't work? I think the better answer is, what can you do to make sure this does work? And that's the statement, and that's the ask that we make to the people of Northern Ireland. These measures are drastic to get us below 1. It's for the length of time that we can then keep it below 1, and that's done by the actions of you, the people of Northern Ireland, that we rely on to do that. And that's why we make these pleas standing here. That's why I've had nurses, doctors, ICU doctors here over the past number of weeks, so that people can understand the importance of their actions. I've often said, standing here, it's your actions today will have a direct effect on where we are in 2 weeks' time. That's as true today as it was back at the start of the first outbreak. So that's why I'm saying to the people of Northern Ireland, you play a part in how we actually manage this and how we actually react to it as an executive.
Minister, with respect, I think these are big messages again, and we've heard this in every single briefing, media briefing, certainly that I've sat on. But what makes you think those who aren't listening will suddenly start to listen? That's the first thing. And specifically for Dr. McBride and Professor Young, probably, I'm wondering if you can explain a little bit more about the science behind today's decision. Not asking for any kind of detailed, publication. Closing pubs but not retail. Doctors' leaders are saying this is, far too little, too late, and doesn't go far enough, while others are saying that, it's far too strict. What's the thinking there?
Look, Michael, to those who don't listen, what I'll say to them, as I say any time that I'm asked, reflect on your actions. You may think you're immune, you may think you're vulnerable, not vulnerable to this virus, but you'll take it. If you catch it, you'll take it, and you can spread it to somebody you love, somebody you actually care about. So your actions do make a difference. So those who don't want to listen or don't want to hear this message, they'd be better just staying in the house and helping all of us. Ian or Michael? Yeah,
just very briefly on your first point, and then Ian can comment on the specific issues around the science. Nigel, thank you. As I've said earlier, there are no easy solutions or simple answers to this, only a series of hard and very difficult choices, all of which have bad outcomes. Bad outcomes in terms of health, impact on health services, but also wider impacts on society and wider impacts on the economy. Now, what's good for our health is good for the economy, and what's good for the economy is good for our health. I've said many times standing here that socioeconomic deprivation, unemployment, poverty shortens and costs lives. And that's why these decisions made by the executive are so very difficult, because the executive is seeking to balance all of those factors. The immediate pressures on our health service to stop our health service and those working in it being overwhelmed, and the medium and longer term consequences on wider society and on our mental health and well-being, on those people who've been shielding in the past, and on the wider economy. Because a good job is good for our health, and there are significant and fundamental risks in terms of young people and their long-term educational attainment and life opportunities, which again I as Chief Medical Officer, and I would urge all other doctors to be very mindful of. Poverty kills people. It always has, it always will do, and it's those difficult decisions that the executive has had to struggle with.
Yeah.
Differently, and the system will have to put in place different levels of support and look carefully at enforcement and other aspects of how we can help to ensure that contacts remain at a lower level. I've said before that all contacts increase the risk of transmission of the virus. Specifically, in terms of the hospitality sector, I'll highlight two key pieces of information. One is that for the majority of clusters that we have identified outside households, they have been associated with and are associated with the hospitality sector. Secondly, when we look at where newly diagnosed cases have been in the 48-hour period before they become symptomatic, that's the infectious period for a pre-symptomatic person, we see that around 30% of them have been in a hospitality setting, whereas only about 5% have been in a retail setting, for example. In addition, we know that the types of interactions people have in the hospitality sector tend to be longer and involve closer interaction than the type of interactions that occur in a retail setting. So that's the type of information which I think leads us to identify the hospitality sector as more important in terms of transmission of the virus than, for example, the retail sector.
Good afternoon, everybody. Maurice Fitzmaurice from Belfast Live in the Mirror. Regarding the measures being introduced this 2-week holiday in schools, the First Minister in the Assembly said that there is limited transmission, for her words, within schools. So I'm wondering if you can explain the logic of the extended holiday in schools, and is it anything to do with, I heard Alden Power on the radio mention something about children are quite often asymptomatic and are therefore not tested. So is there a concern that maybe there are more in schools than we realise because of a lack of testing of school pupils?
I think, Mars, I was in the chamber for the First Minister's statement this morning to support her in the decision that the executive had came to. She referred to some work that has been done with the Public Health Agency, supporting the Department of Education and the Education Authority in regards to the supports that have been given to schools from that side. And I think what it was indicating, what it is indicating, I'll ask Michael to give an update in a minute, was that the transmissions within schools are very low, but it's the transmissions and the infections that are associated with the activities around schools. So the pick up at the school gates, the extracurricular activity, even transport to schools. It's those settings where we are seeing that indication and have the concerns. So we welcome that 2-week break in the education system that would allow all those interactions, all those social interactions and all those possible chains of infection to be broken as well. Michael, do you want to?
Thank you, Minister. And Morris, thank you for your question, a very important question. And just to reiterate the Minister's response, that the risk associated with and our experience of transmission within schools is that it's low. If we look to the numbers as of Sunday, the 11th of October, we know that over 50% of those positive cases in schools relate to single cases. Just under 40%, or just about 40%, are related to 2 or more cases. And indeed, if we look at the number of incidents relating to outbreaks in schools, it's in and around 4.5%. So what we are not seeing is significant outbreaks associated with or transmission within schools. And as Minister has indicated, the upward pressure on R that we see from schools being open relates mainly to activity around school settings, such as the travel to and from school, school-related activities, and the activity of children when they are back at school and are socialising with each other. Ian, maybe you could give a little update on the assessment of the impact of school closure on R.
So in addition to interactions between children, adults interact differently whenever children are at school. And some of that is indirect because adults are freed up from childcare responsibilities and will interact more with each other. So there's a lot of things that are different whenever schools are open versus schools being closed, all of which lead to an estimate that opening schools increases R by 0.2. Now that's the difference between having R around 0.7 when schools are closed, for example, versus 0.9 when schools are open. And in turn, that translates through to the potential for more transmission of the virus.
As a supplement to that, to be blunt about it, Minister, what are the chances that we will be back here with another raft of measures introduced at the end of November, beginning of December, if these measures that are being introduced at 6 o'clock on Friday do not bring about the required results?
Well, Morrison, I think that's, I answered that to a previous question. It's how the people of Northern Ireland now react to these measures. We can do as much modelling as we can with numbers, the potential impacts, but what we need now is that interaction, that buy-in from the general public in Northern Ireland to realise, if we can get R below 1 as soon as possible for and as long as possible, it means we don't have to go back to look at any measures being reintroduced for any length of time. What we want to do now is ensure that the measures we have introduced has the maximum impact on reducing R and on reducing the spread of this virus.
Hello, can you hear me all right? Yeah.
Yeah, Amanda, yeah.
Okay, Public Health England publishes data from the test and trace system that shows where the virus may have been contracted. And I think eating out and shopping are the two activities most commonly reported in England. I think it was Ian Young mentioned there that hospitality is one of ours. I'm just wondering, what does the data for Northern Ireland show? By hospitality, do you mean hotels, pubs, restaurants? And also, why is this information not published?
Ian, do you want to get up to that? And I suppose, Amanda, the reason it's not published is because we're just starting to collate this together to make sure we can get it in presentable data so that the PHA can put it out either in their weekly bulletins or their monthly bulletins. It's ensuring that it is validated and it is publishable. But in regards to the settings, Ian, you've already mentioned a few of those.
Yeah, so whenever we refer to hospitality, we include restaurants, pubs and cafes. Hotels are slightly separate in that they tend to be venues for special occasions, but restaurants and hotels, in terms of being open to guests from outside the hotel, would have similar characteristics to hospitality settings in the other groups that I've mentioned. So whenever we talk about hospitality, we talk about the collective of those.
Okay, and just as a follow-up to that, Ian Young, you previously said that you felt that Northern Ireland was more likely to require more than one circuit breaker to get through winter. Is that still your position? And also, just because we saved best to last, I may as well be cheeky and ask the Health Minister. Mark Drakeford has placed a ban on people from COVID hotspots in the UK from entering Wales. Do you think that's a good idea? And is it something that Northern Ireland might consider?
I seen the headline, Amanda, just on another news agency just before I came into this briefing, so I haven't had an opportunity to talk about that with Von Gethin, who's my counterpart in Wales, as to the rationale behind it, how they're going to implement it, or even the effect that it'll have on the common travel area as well. So I'm unsure as to how it will be policed, how it'll be managed, but I'll have that conversation with Vaughan when I get the opportunity to seek clearance as to exactly what the rationale is and how they intend to manage that. Ian, do you want to pick up on that?
Yes, I mean, as Minister said, and I fully agree, a cycle of repeated interventions of this kind is not a sustainable way through the winter. So the solution is to have a really good, strong impact with this intervention, to bring all aspects of the epidemic down to significantly lower levels, and then to reset our individual behaviours and also to reset all those parts of the health and social care system, the support system, the enforcement system that can be reset to try to make sure that we don't find ourselves in this position again.
Okay, thank you.
Welcome back. We've been watching today's press briefing from the Department of Health with Health Minister Robin Swann chairing today. We'll get on to some of what was talked about and discussed in just a second on the back of all those new restrictions that kick in on Friday in Northern Ireland. But before we do that, I just want to let you know about a new special we have happening tonight right here on the channel you're watching on, whether it's our Facebook Live, Twitter, or YouTube. You can look for this go live sometime after 8 o'clock tonight. The First Minister will be coming on to answer some of our questions and hopefully some of your questions as well. I'll be speaking to Arlene Foster tonight. We do this live after 8 o'clock. In the meantime, if you do have a question you would like us to put to Arlene, I'm going to ask anyone watching right now to send that to us via a video recording. So just tell me who you are, what your question is for the First Minister, where you're from, pop that on a video recording and send it into the Cool FM or Downtown DM inbox on Facebook. That's probably the best way to get it to us. Don't be writing your question. I'm going to ask for video questions. So video yourself, record on a short piece of video just who you are, where you're from and what your question is for the First Minister. Put that to us via video only and send it into the DM section on the Cool FM or Downtown Radio inboxes on Facebook. Okay, that tonight from 8 o'clock. Right, so what do we just hear from the Health Minister? Well, I suppose the big news there that he revealed, the Nightingale is to be stepped up again. It's going to become a full regional NI facility for COVID patients. This was, of course, the Belfast City Hospital tower block, which was previously converted into a Nightingale facility during wave 1 of the pandemic. That now officially is being reinstated as of today. Robin Swan has announced it. Here's what he said.
The Belfast Trust this week has had to expand its COVID ICU from the Mater to the Belfast City Hospital tower block. This afternoon, in light of further sustained growth in the level of patients requiring admission and ventilation, I have formally agreed to the Nightingale once again to becoming a regional Northern Ireland-wide facility. It's not something I wanted to do, and it's a decision I tried to hold off on for as long as possible. However, we are now in a place of all trusts reporting rapidly escalating pressures. The virus is spreading exponentially, and urgent action was needed.
So that's the Belfast City Hospital. It will be transformed back into Northern Ireland's Nightingale facility for all trusts, according to the Health Minister Robin Swan there. He referred to the rapidly escalating pressures across all trusts at this time as the reason behind that. And he went further to plead with the Northern Ireland public to please get behind the new restrictions to help make a difference.
Please play your part. Be part of the resistance, reduce your contacts, and keep your distance. Wear a face covering, wash your hands, download the Stop NI app, and if you have symptoms, self-isolate and get tested. Please do that. Do it for the people you care about. Do it for the old and do it for the vulnerable. Do it for the people with the underlying health conditions who are absolutely terrified of contracting the virus. Do it so that we can weather this storm and get through to the other side, because we will.
Robin Swan also said today that the circuit breaker, or what we're now commonly being referred to as Northern Ireland's reset, that seems to be the buzzword that I hear creeping in now. So it seems to be reset is the one that they're going to try to test us with over this next few days to see if that's the one that sticks. He said that the circuit breaker would not be the answer, but it does buy us time. He says that we now have a window of opportunity with the new restrictions that are coming in on Friday. It will give us breathing space for our health service, give each other space, he went on to advise, reduce your contacts, and he talked about hope and better days ahead in time for Christmas. There was also a lot today being asked of the rationale behind this huge swath of restrictions that we heard are going to be coming into force in Northern Ireland on Friday. Schools are going to be closing down. The entire hospitality industry is going to be closing down. Certain areas of retail, such as hairdressers and close contact businesses, all will be closing down, with other restrictions and curfews announced on other sectors. And I'll recap everything for you in case you've been a bit under a rock today and you've missed some of it before we finish off our live broadcast today. But with all those restrictions, rightfully so, a lot of the journalists and a lot of people who have been watching our stream are asking, well, what is the science? What is the rationale behind this? Has it been presented? Is it going to be made very abundantly clear and public at some point? I heard the Chief Medical Officer and the Chief Scientific Advisor referring to websites and bodies of work that there is information available, but the reality is the Great Northern Ireland public clearly are not hanging around the same websites as those two fellas. Here's what Robin Swan said.
Unfortunately, what prompts these decisions is the rise in positive cases. What prompts these decisions is the rise of hospital admissions. And unfortunately, what prompts these decisions is the number of people losing their lives from COVID. So that's what united the executive in making the decisions that we we had to take and the decisions that we took last night.
Now, of course, that still won't go far enough for a lot of people right now, people whose job is now in threat, people whose businesses closed down on Friday. What was the exact science behind having to close down hairdressers, but keeping other parts of retail open, but closing down the bars, where we heard that the mitigations that were in place made these one of the safest places you could be? The restaurants, it was all safe. We were told just a few weeks ago, actually, all the problems and all the indications were that this increase in infections were coming from where people were relaxed, where they were mixing together in indoor settings, where there were not mitigations in places, hence the restrictions on mingling in households and private dwellings. A lot of people still not satisfied that they're being told everything they need to know in terms of making peace with these huge amount of restrictions to our everyday life that come into force as soon as 6 o'clock this coming Friday. A lot of businesses with around 48 hours to completely get their head around this and to figure out where they go next, particularly now with Christmas in sight. The Chief Scientific Advisor, Professor Ian Young, shared some new charts with us today as well. Let me remind you of what those were, and we'll put some of them up on the screen now. I'll just talk through them as they appear on the screen. This is all new information just with us today. First, we're going to start with a 7-day rolling average in Northern Ireland throughout the pandemic. Here's, of course, the reason why we are where we are right now. And you can see how we're literally going off the chart here in the past week or so, with that 7-day rolling average across Northern Ireland up into the region of 900 cases. And you can track it right back there along that line to where we were in March. Now, of course, context for that will be the testing. And I think if we can show you the testing chart next, that will give a little bit of the context for this, because, of course, testing has also increased massively. We're testing to the hilt at the moment. In fact, we've got one of the highest percentages of testing anywhere in the UK, and certainly in a lot of places around the world now. There's 30 people per 1,000 population in Northern Ireland around now being tested on the 7-day rolling average there. And you can see how from again, back at the beginning of the pandemic, early doors March, where our testing capability was, and how we've ramped up testing in a massive way to 30 in this past few days per 1,000 population in Northern Ireland. So with the testing comes the increase of positive cases, and if we can maybe just look at that next, because of course that has gone up as well. Now, of course, they are saying that, of course, more testing, you will get more positive cases, but it's not comparative, and that the positive cases outweigh the amount of testing that's going on at the minute. So let's look back here since July on the 7-day rolling average for the positive tests that we've been getting come back, and it's in and around 12.5%, 13%, again, as high as it's been. So that's the positivity rate, but we know recently, single days, that figure's been closer to 20%. Today it's in and around 18%, slightly down on yesterday, and that's worth saying. Those were the individual percentages. These are the actual tests, because of course some people will be tested more than once, etc. So these are all tests you're looking at, not necessarily individual tests, but all tests. So perhaps people being tested 2 or 3 times in order to get the correct result. Today was in fact a record day for Northern Ireland. There were over 1,200 positive cases came back, and there was again equally though a record amount of testing as well, over 6,500 individuals. You can see there at the bottom of the screen, 6,500, 6,538 to be precise, individuals tested. There, just to the left of that number, you can see the number 10,620. That's the total number of tests. So again, you can see that a lot of those tests double up, but individually, just over 6,500 actual people tested, and from that it returned 1,217 positive cases, which is a record amount of cases today in Northern Ireland. But again, as I always like to say, the context is the increased testing, and actually the percentage is slightly down on what it has been the past 2 days. It's still riding well above the 18% mark, and as we heard Michael McBride say during today's press briefing, the World Health Organization consider anything above 5% as an out-of-control pandemic. So it goes some way to explain the situation Northern Ireland is in right now. Let's look at the R number, because we're hearing a lot about that again. It seems to come in peaks and troughs, the R number, because when the community transmission is low, R is not as robust. The sample in the data is much lower. There's not as much science that goes into it that is worthy of looking at. But when the community transmission is as high as it currently is in Northern Ireland, R is clearly a much more important factor, and we heard a lot more about that today. My suspicion is we're going to hear a hell of a lot more about R now over the next few weeks, because it's something that is easily digestible by the public. People kind of understand that anything above 1 is not good, and that the mission here collectively among the public is to push this back down below 1. I remember at one point there, you can see not so long ago, it was down to 0.3 in August, whenever we in many ways had hoped that this was all long behind us. It's crept back up again from then. That was at the end of July. It was down to 0.3. It crept back up. It's been as high as 2. Of course, community transmission was much lower there, so the sample was lower, but there's a robust amount of data now, given that the infections that exist and the positive cases that exist out there are as high as they've been. So the guess at the moment is that R in Northern Ireland sits at about 1.5, and they need to see that well below 1. And looking at the latest fatalities in Northern Ireland, some very sad news today. We surpassed another grim milestone. This time we have gone over 600 deaths in total since March. Another 4 added on to the total today takes our total in Northern Ireland to 602. 2 of those deaths in the most recent 24-hour reporting period, 2 from just outside that period. And Ian Young, when speaking, he was again warning that on the current trajectory, our hospitals will exceed the first peak of the pandemic within the next 7 to 10 days. This is if things went unchecked. There you can see that the graph he shared to support what he's saying there. This is the hospital inpatients, and you can see sort of at the peak back at the end of March. Now this has most recently been updated just a couple of weeks ago, and you can see where it was clearly going. It's continued to rise over that time. I think, and just correct me in my ear if I'm wrong, but are we up to 160 inpatients today in hospital? I'll just check that for you. I think we'd gone up again. It certainly has been increasing. So today we have 164 hospital inpatients, 24 of which are in ICU. So you can see the concern from our medical professionals that at the current rate we will surpass wave 1 in the next 7 to 10 days. That's why these guys were adamant that whatever decisions came had to be made quickly, and it had to become before Friday. So we're effectively looking at a 4-week circuit breaker or a reset, whatever you want to call it. Schools taking a 2-week break, so not too badly disrupted for education. And in fact, Arlene Foster, when she was speaking this morning, and I'll be talking to her about this a little bit later on in the night as well, she did reference this, and she was confident that the education of our children will be least impacted by all these changes.
In education, the half-term holiday break will be extended from the 19th to the 30th of October, with schools reopening again on Monday the 2nd of November. To permit this, the Department of Education will allocate to schools 2 of the optional days and the remainder of additional time through exceptional closure days. As across.
Okay, we're just about out of time. Just a reminder, Arlene Foster News Special tonight after 8. We'll go live on Facebook with the First Minister. We'll be putting some of your questions to her, and we would love to hear from you. So anything you want to get us into the inbox, you can drop that into us now. And just finally, these were the stark words from the Health Minister, Robin Swan. He was talking to some of the journalists about people who have no interest in paying attention to the new restrictions, people who can't be talked to at this point, that are going to continue doing their own thing. And he had this rather blunt retort for them today. Take a listen. Okay, and we don't have his blunt retort. Well, I can tell you what he said. He said those who don't want to listen would be better staying in the house and doing us all a favour. Oh, we do have it. Hold on.
Reflect on your actions. You know, you may think you're immune, you may think you're vulnerable, not vulnerable to this virus, but you'll take it. If you catch it, you'll take it and you can spread it to somebody you love, somebody you actually care about. So your actions do make a difference. So those who don't want to listen or don't want to hear this message, they'd be better just staying in the house and helping all of us. Ian or Michael?
Yeah, just very briefly.
Well, there you have it. You can't really have more blunt than that then, really. Stay in the house, do us all a favour. On that note, we'll say goodbye for the afternoon. Thanks for switching us on, as always. Hopefully the updates are useful for you. You can see a full list of all the new restrictions that come into force. Were announced today. They'll come into force mostly 6 o'clock, end of play on Friday. There they are, all laid out there. Full comprehensive details through the Downtown Cool FM social media pages and on air as well. So make sure you have a look at that if you want to familiarise yourself with some of the detail. Of course, there's still a lot more guidance around all of this that needs to be announced and revealed. We don't have it yet, but as we get more clarity and more detail around how some of the individual guidance is going to work in some of these points, we will when we make that clear through our websites and our social media as well. Right, so we expect the next executive meeting with our ministers tomorrow afternoon, and then more than likely, as normal, the Thursday press briefing will be here, and Arlene Foster will be taking questions from the press, perhaps with or without Michelle O'Neill. We know she's still self-isolating at home, so we're not sure if the Deputy First Minister will be joining in on that tomorrow from home remotely or not, but that's when we're next expected to go live with our continuing coverage for Northern Ireland. For me, Stuart Robinson, thanks for watching this afternoon. Have a good night. We'll see you next time. Bye-bye.
Coronavirus is still here and it's spreading, so it's important that we continue to follow the rules to help keep everyone safe.
Maybe you're a student starting a new course or coming together for a new term. We all enjoy having a good time with our mates, but do it safely to help keep everyone safe.
Please don't bring the virus home with you, as you could spread it to your parents, a grandparent, or even a friend with asthma. That's why I'm following the rules. I want to protect my family and friends.
Don't gather in groups or parties. We know it's hard, but it's worth it. The fewer people you come into contact with, the less chance you have of catching and spreading coronavirus.
Keep your distance from others.
Keep washing your hands well and often.
Wear a face covering, and remember, in some places such as public transport and shops, it's the law. And be kind to those who can't wear a face covering because of health reasons or disability reasons. Children under the age of 13 aren't required to wear a face covering either. Download the Stop COVID NI app from your app store to help with contact tracing. It will alert you if someone using the app tests positive for the virus, or alert others if you test positive. The more people using the app, the more effective it will be in helping to control the spread of the virus. Doing these simple things will not only protect you, but your loved ones and those around you, like your friends and family.
The more we protect each other, the sooner we'll get back to normal.
It's not always easy to follow the rules, but if everyone does it, we will save lives.
We all must do it to get through it.
For more information, visit nidirect.gov.uk/coronavirus.
Download the Stop COVID NI app to help stop the spread of coronavirus. This app from our health service tells you automatically if you've been near someone who tests positive. It also tells others if you test positive, but will never know or share your identity or location. Most people spreading the virus don't know they have it. So the more people using the app, the more lives we save. As we go out more, let's all keep doing our bit. Download Stop COVID NI from your app store now.